I'm going to be very brief in my introduction. I want to acknowledge my respect for the Centers for Disease Control and the fantastic job that they do. We're very pleased to have two representatives of the CDC here today. This meeting is grounded in the science and practice of public health. With all of the work that has been done on the climate crisis and the solutions to the climate crisis, many would argue that too little attention has been paid by many to the health consequences of the climate crisis. And we hope to help remedy that today. It's an amazing gathering of scientific and medical experts from all around this country and from around the world. Two of our presenters will have to present by video because they have done medical work in Iran and were denied visas to attend this meeting as a result of having traveled to Iran. That's another issue, and I don't want to get into that. But we've had a few obstacles. Those who have been working in this field for so long, my hat's off to you. You have done an amazing job for so many years, and I have been privileged to have the opportunity to learn from you. But I just want to begin by expressing all of that gratitude that I feel. We'll have these opening comments, and then I think you have the program, so I won't preview it for you. But it's my pleasure to introduce Dr. George Benjamin. Let me just say that the way this came about was that the CDC asked me last fall to give the opening keynote for the conference that had been scheduled, and Dr. Benjamin and his group, along with these others, were instrumental in planning and organizing the original conference, and for reasons we don't need to go into, it was abruptly canceled, and the experts who had been looking forward to this felt it would be valuable to go forward with it anyway. And the American Public Health Association has declared this year the year of climate and health. And this is actually the kickoff, you could say, of a year's worth of events. At the end of this year, the Public Health Association will have a very large meeting in November that will be the capstone of this full year's worth of events. But this is the kickoff, and it's a great privilege to be here, and it's my personal privilege to now introduce the head of the American Public Health Association, Dr. George Benjamin. Thank you, sir. Thank you.
Try that one more time. Good morning. Good morning. That's much better. Let me tell you, there's 340 of us in the room here, and probably thousands of people who are watching this on their computers through livecast or Facebook. And obviously, as you know, this is a very important meeting on climate and health. I also want to thank the Vice President for his remarkable leadership. The truth be told, your staff calls you and says the Vice President's on the phone, and then they clarified it was Vice President Gore. And I said, and he picks up the phone and he says, I just talked to President Carter, and we think we ought to move this meeting along, and what do you say? But yes, sir. Also, just the same, give my special shout out to President Carter for his support of this as well. And let me talk, there's a slide I want them to put up around some other organizations that are supporting this. Note that we have over 50 organizations representing thousands of scientists, policymakers, and citizen advocates that have joined what we call our partnership circle. And I wanted to thank them publicly for having our back Their public support sends, I think, a very, very strong message to the climate deniers that our work in this area of scientific discovery and public health practice is here to stay and will not be impeded by denial, misdirection, or intimidation. I also want to acknowledge my colleagues at the U.S. Center for Disease Control and Prevention. I'm absolutely glad to see you in the House, and I wanted to make sure that I publicly also let them know that we have their back as well. So the question is, why are we here today? You know, APHA first recognized the climate impacted our health back in 1923, when a committee report from the Committee on Public Health Climatology first reported on the link between climate and health, at least to us as an association. And we've certainly been working in this area ever since, accelerating our efforts in 1995 when we passed a policy entitled Global Climate Change. And of course, have been working to really make this link since that time. I'm also pleased to recognize that we have a lot of distinguished APHA members, including our current president and several past presidents of the American Public Health Association here in the audience. Now, our work in this space, as you heard from the Vice President, has led us to declaring 2017 as a year of climate change and health. This year-long initiative to raise awareness and mobilize action, two key words, raise awareness and mobilize action around this issue. And you also heard we're dedicating our meeting this fall, or we'll be bringing, so here we have 340 of our closest friends in the room. We hope to bring over 12,000 of your closest friends back here to Atlanta to continue this conversation in November. Our theme is Creating the Healthiest Nation, Climate Changes Health, and we look forward to hopefully many of you continue to participate not only at our meeting, but there are an amazing number of other events that are going to happen over the year. Now, it also happens that today is Environmental Justice Day, which is part of Environmental Justice Month. And while we didn't plan it that way, you know, sometimes fate aligns with the righteous. And addressing climate change is clearly an issue of social justice. You know, disproportionately vulnerable groups like our children, the elderly, and the underserved, particularly often in minority communities, are less climate resilient. Kids are not just small adults, as you know. Their bodies, which are always developing, have real significant problems with the challenges that are wrought by climate change. The elderly suffer most in extreme heat. Illness and death occurs readily for those folks. And obviously, as I've gotten old, I've recognized the mobility issues in getting old. Low-income communities have inadequate access to medical care and resources, and a range of other social determinants which make them much less resilient. And that brings us to the issue around disproportionate impact around health. The uneven burden of climate change is by definition climate injustice. And of course we know the great words of Dr. Martin Luther King Jr., that injustice anywhere is a threat to justice everywhere. And I believe this is especially true in climate change. Therefore, I believe we must explore our vulnerabilities and address the most vulnerable populations in the world as part of this effort. And that brings us very much to addressing the health needs of both the folks in our country, but frankly, this is a global issue and the health needs of the people in the world. So for those of you who are here and those of you listening to this important conference remotely, I just want to let you know you're the vanguard of this movement. As we raise your awareness here today, we encourage you to raise the awareness of others. We want you to understand that the science that we share with you today is designed to empower you to address these challenges, to mitigate the serious threats to our health. I want to thank you for joining us. You know, I believe at the end of the day, history will mark today as an important step in our quest to address the negative health effects of climate change. And I thank you. I'd now like to bring to the stage a colleague, Dr. Ashish, who's the director of the Harvard Global Health Institute. Dr. Jha.
Good morning, everybody. Thank you, Dr. Benjamin, for the introduction, and thank you, Vice President Gore. I am so proud to share this stage with these two individuals and to the others who are hosting this event, and could not feel more excited about what we have in store for us today. Before I get started on my formal remarks, I just want to take 30 seconds and acknowledge Vice President Gore's leadership. It is hard to overstate the importance of that leadership. Your vision, your fearless and tireless efforts. I don't think there's anyone on this planet who has done more to raise awareness about the importance of climate change. So thank you for your leadership, sir. And thank you all for joining us and sharing in the commitment to tackle climate change and protect public health, here and around the globe. And that is why we are here, because this is about health. This is about my health and your health, our children's health, our parents' health. It's about all of us. And this is why, while we may spend today reflecting and learning, at the end of this day, we all need to commit to action. Because you see, the price of delay is too high. And we have to remember what's at stake. 100 years ago, a child born on this planet had a 1 in 3 chance of dying before the age of 5. That number has been cut by 90%. That is remarkable progress. And much of that gain has come from better nutrition, more plentiful food, better crops. But here's the problem. As the world warms, and as hot places get hotter, and dry places get drier, we will see more droughts, we will see more famines. The nutritional content of food will change. And the children and families who are thriving now will face hunger, they will face malnutrition, they will face diseases, and they will face death. And as the weather becomes more extreme, the pollution that is all around us, it's going to become deadlier. We will see more cases of asthma and heart disease and stroke. And as the climate changes, so will the infectious diseases that we confront. More outbreaks like Ebola and Zika, more pandemics like the bird flu. And here's the catch. Walls will not keep these pathogens out, right? No borders are going to protect us. That's what awaits us unless we act. And so today, we must all commit to acting. So I come from a university, and in universities across the country, we think every day about how do we turn knowledge into action. See, universities have a very specific and I think a unique role to play in both addressing climate change and protecting public health. We are the research engine of America and the research engine of the world. We develop the knowledge that helps us better understand the mechanisms of climate change and how it impacts public health. But remember, universities, American universities, have a special contract with the American people. And the contract goes something like this. We commit to working on the most pressing issues facing our citizens and facing the world. And the American people, through their government, commit to supporting that work. That commitment, that contract, has advanced and revolutionized science and medicine. I would argue it has served the American people very well for a very long time. And it has been an important part of America's intellectual and moral leadership in the world. Today, ladies and gentlemen, we must make these commitments once again. We must commit to funding and supporting research on climate change and its impact on health. And thank you. And I believe that's how we become smarter about protecting the American people, and that's how we begin to share knowledge to protect people around the globe. Universities create and share knowledge, right? That's what we do. And through that knowledge, we educate not just our students, but the broader public. And here, I think we as universities need to do a much, much better job helping our citizens and our policymakers understand what's at stake and what must be done. Of course, we have a special obligation to our own students. And whether you're an 18-year-old college freshman showing up for the first time or a 70-year-old who has come back for lifelong learning, we must commit, all of us who are at universities, we must commit to ensuring that everyone who walks through our halls understands the science of climate change and the linkage to public health. You know, health is the human face of climate change. That's what Michelle Williams, the dean of our School of Public Health, likes to say. And she's right. This is not just about temperature rises and sea level changes, though those are important. It's about fighting hunger and starvation. It's about preventing that child's asthma attack. It's about stopping the spread of diseases. Ultimately, it's about creating a world where children don't just make it to the age of 5. They grow up to be adults who are thriving and healthy and productive. That's the world we want. And universities like mine and others recognize that's the threat we face. That's the world we need to have that is threatened by climate change. And we want and we need to be part of the solution. To meet the public health challenge that is climate change, to produce unbiased, data-driven research, and making it both accessible and actionable, to training the next generation so they understand the science of climate change and its impact on health, and to educating the American public and American policymakers, and really global policymakers, so they too understand the effects of climate change and the cost of inaction. So that journey, the journey of better understanding, of real action, that journey begins again today. Thank you all for joining us on that journey, and thank you all for being here.